Assalamualaikum and greetings. My name is Fatin, a fertility specialist in this clinic. Today, I'm going to assist you regarding the problem you face. I'm going to start by explaining about physiological process of ovulation. Every month, women will release at least one matched egg from ovaries, which is known as ovulation. Ovulation process are controlled by a few hormones such as estrogen, LH, FSH, and also progesterone. At the beginning of menstrual cycle, the pituitary gland will release FSH that will stimulate the growth of ovarian follicle. As the follicle grows, it begins to secrete more estrogen. So estrogen will initiate the technique of endometrium. When estrogen level increases, it will trigger LH, which will cause follicle to rupture and releases egg. Based on the case, it shows inconsistent ovulation pattern occur due to reduced level of LH. After ovulation, the ruptured follicle will turn into corpus luteum that will begin to secrete progesterone, which maintain and further thickening the endometrium to support any possible pregnancy.
Assalamualaikum and greetings. My name is Batrisyia and I am working as the obstetrician gynecologist in this clinic. So today I am going to explain the biological process of human fertilization. So fertilization begins after ejaculation when sperm travel through the cervix and uterus into the ovida. Before they can fertilize the ovum, sperm undergo a process called capacitation in the female reproductive tract. When a sperm reaches the ovum, fertilization occurs in three phases. First, the sperm penetrates the corona radiata using the enzyme hyaluronidase. Second, it penetrates the zona pellucida through the acrosome reaction, releasing enzyme that digests this layer. Third, fission of the oocyte and sperm membranes. The sperm enters the oocyte, triggering four important events: fast block, slow block, meiosis completion, and syngamy, which is fertilization.
My name is Mashita. I am your reproductive endocrinologist. I analyze your condition of irregular ovulation and a reduced LH. The LH is essential for triggering ovulation. When the LH is too low, ovarian follicles may not mature properly or release a viable egg. As a result, ovulation may be delayed or may not occur at all. A reduced LH can also impair the formation of the corpus luteum, which normally produces progesterone after ovulation. Lower progesterone levels cause the uterine lining to break down, leading to menstruation instead of preparing for implantation. Therefore, irregular ovulation and a reduced LH decrease the chances of successful fertilization and pregnancy by limiting egg release and creating a less favorable environment for implantation. Hence, the likelihood of implantation in your case is low. LH plays an important role in normal reproduction. It triggers ovulation by causing the mature ovarian follicles to rupture and release an egg into the fallopian tube. It also promotes oocyte maturation, initiate the formation of the corpus luteum, and stimulate progesterone production to prepare the uterine lining for implantation. So when the LH is disrupted, ovulation may not occur, resulting in anovulation and a reduced chance of fertilization. It can also cause irregular or absent menstrual cycles, reduced fertility, impaired corpus luteum formation, and low progesterone levels. These effects make implantation and pregnancy more difficult and are commonly associated with conditions such as polycystic ovary syndrome, hypothalamic dysfunction, and pituitary disorders.
To address the patient's irregular ovulation, I recommend two interventions. First, clomiphene citrate, which stimulates the hypothalamus and pituitary gland to increase FSH and LH secretion, promoting follicle development and ovulation. Second, stress management, as stress can disrupt GnRH, FSH, and LH secretion, leading to irregular cycles. Reducing stress help the patient to restore normal hormonal signaling and regular ovulation.
Hi, my name is Nisa Nurjeeha and I am a reproductive endocrinologist. Now I will be explaining what happens when fertilization occurs successfully but implantation fails and how this affects the establishment of pregnancy. After successful fertilization of sperm and egg in the fallopian tube, the fertilized eggs or zygote undergo cleavage and develops into blastocysts. Normally, the blastocysts implant in the wall of the uterus around 7 to 14 days after fertilization. After implantation, trophoblast cells secrete HCG, which stimulate corpus luteum to continue secrete progesterone. Progesterone helps to maintain and strengthen the uterine lining, allowing the pregnancy to continue. If implantation fails, the trophoblast cannot secrete sufficient HCG. Then, corpus luteum cannot be stimulated and it cannot secrete progesterone. As a result, the uterine lining breaks down and it sheds as menstruation. Consequently, the embryo is lost and pregnancy fails to establish.
There are few artificial reproduction technologies that you can try to successfully conceive. The first one is ovulation induction, where medication were used to stimulate ovaries to develop and release eggs. Fertility drugs are given to encourage follicle growth in the ovaries. Second is in vitro fertilization, IVF, where eggs are collected, fertilized with your husband's sperm in the laboratory, and the resulting embryos will be transferred to the uterus. The third method you can try is frozen embryo transfer, FET.
In conclusion, successful pregnancy requires proper hormonal regulation and successful progression through ovulation, fertilization, and implantation. Understanding these biological processes help us identify suitable treatment options and assisted reproductive technology. Thank you for watching. We hope this explanation has helped you better understand the reproductive process.